Hi, this is Dr. George Springer. This is first in our series of Children's Health Naturally. You know, as I travel around and talk with different parent groups and even the patients who are coming in here, one of the things I constantly hear from patients is that they're tired of really dragging their kids to the pediatrician and constantly getting antibiotics, or even really needing to resort to something like ear tubes or some problem in terms of really having a tonsillectomy done. They don't want to do that for their kids and they're looking for some other alternative situation. That's kind of what happened for a patient of mine named Jackson. His grandmother is a patient of mine, and he actually lives in Seattle, and she brought him in because he was beginning to have problems with breathing, and he'd had recurrent allergies really since he was born, and they'd been through a repeated series of antibiotics, and they had also really gone as far as actually doing a tonsillectomy. And not only was Jackson not better, but his stomach was beginning to bother him, and he was beginning to develop a lot more asthma symptoms that they figured that he might have throughout his childhood and perhaps the rest of his life. Well, the problem is that Jackson didn't need 50 days of straight antibiotics. And the problem is that Jackson's condition did not resolve because of his tonsils, because that wasn't the overall situation. What I found is that we have patients coming in a lot of times who have trouble with their digestive system. And that digestive system then gives rise to all sorts of issues in terms of allergies. And as these allergies begin to mount up, one of the big issues we have is that of histamines. Histamines causes fluid. It causes fluids in the nasal passages, it causes fluid in the ears, and that makes things ripe for an individual to start getting secondary kinds of infection, like ear infections and those kinds of issues that can begin to follow. So what I did with Jackson, as I do with so many kids coming in, is I make sure that their digestive systems are actually functioning like they should. Because many times they have a condition called leaky gut. Leaky gut gives rise to multiple food allergies, which really kick up the histamines. And when those histamines are higher, they're going to be having more congestion and all the things that begin to follow with that. So the real key in many of these children is to actually look and try and get to the cause of their constant histamines, and the fact that 70% of the immune system is in the gut also makes them more resistant to colds and those kind of things that can come along as they're in their school environments and those different kinds of areas. Because going and getting constant antibiotics is not something that's going to give total resolution. In fact, there's been studies out now, one by the Henry Ford Institute of Health Systems, where they've actually followed 480 kids from the time they were born to age 7, and found that if antibiotics were given prior to age 1, that those children were 8.9 times more likely to develop asthma and 1.5 times more likely to develop different kinds of allergies. And those studies have gone on. The University of British Columbia actually did exactly the same thing. But this came, they did a retroactive study of first 12,000 kids and later on of 22,000 kids. And they found exactly the same thing. Antibiotics given early in life makes and predisposes the child to having allergies and asthma, which then of course gives them further round of antibiotics. One of those studies showed that actually 16% increased risk of every single dose of antibiotics that was given to a child. So those are pretty startling statistics. And in Jackson's case, he wasn't suffering from an absence of antibiotics. What he was they weren't getting to the cause. Jackson was here for 2 visits in a period of 1 week. At the end of those 2 weeks, Jackson continued to go home with the regime I gave him. And he's totally resolved now. No more breathing problems, no more congestion, no more repeated trips to the doctor, no more stomach aches. It is totally resolved in 2 years what the conventional approach did not resolve in 4. Those are the kind of things that we want to do for children, because these gut issues especially can begin to also bridge over into other kinds of things like behavioral issues for children, and even can begin to impact conditions such as autism and even children who are other neurologically compromised. So the real message here is that get to the cause, don't just keep hammering on the overall symptoms with things like decongestants and antibiotics in terms of your child. And if you really are worried about allergies, one of the first things you can do is realize that it's not a situation where we're going to be having antibiotics being the solution. The real solution is to look to the overall cause. So that's actually treating your health naturally. What we do is evaluate the kids and determine if indeed they have this leaky gut. We do some laboratory testing occasionally. Things are very non-invasive here to make sure that we can get to the cause of what's there. And we just balance out their digestive system and we determine if they have food allergies. There's several easy ways to get that accomplished. We employ a couple of those in here, and we actually can help desensitize the child to those foods without going through a bunch of shots and things that are typical in conventional medicine. So we have very good successes, and for me, my motivation is I've got 5 kids, and I want to treat every child coming here as if they're one of mine, because my children grew up with very few, if any, antibiotics, as well as a lot of other kinds of intervention. So that's our first segment. Next time we'll talk a little bit more about autism, a little bit more about issues in terms of hyperactivity deficit disorder and attention deficit disorder, and we'll go over that next time. So till then.